Hi, I'm Tim, I'm an osteopath, and today I'm going to talk about lower back pain and the myths that surround it. So the first myth is that lifting is bad for your back, particularly your lower back. When lifting, there's a lot written and a lot published on YouTube, I'm sure, but essentially you've got to assess that what you're lifting, you're capable of lifting. That's the first thing. Secondly, then use safe manual handling techniques. So you're keeping your back straight and using your legs. Probably the most important thing is don't twist or lean and twist when lifting, even if it's light, because this is when I see, as an osteopath, most injuries happen to the lower back. And finally, on the myth, is lifting bad for my back? My probably best advice is, when you hurt your back, lifting, it may be something light, so you're kind of a little bit confused, but actually, most of the time it's because you're not warmed up and ready for that lift. So many people I see in the clinic have lifted a pot plant, they've lifted a sofa, and they've hurt their back. And they actually think that the lift is the sole reason why they've hurt their back. If you were to go and play sport, you'd warm up. But nobody warms up, until I've told them after the event, prior to DIY and gardening. So lifting isn't always bad for your back. Warm up ahead of the activity and you should see less injuries. Myth number 2 is wearing a back support is bad for my back. So wearing a back support is like wearing any other support for a joint. It assists the muscles and ligaments during times of pain and during injury. So if you buy a back support and choose to wear it all day, every day, then I'd be the first to agree that wearing a back support is bad for your back. Your muscles and structure will become reliant upon it. But wearing a back support can be helpful. It's about the use, when to use it, and not abusing it. So I actually think wearing a back support has many benefits also. If you're a person and you may have had surgery or you've got long-standing lower back problems, your life can become very limited. Even sports, gardening, just hobbies can be very limited because the consequences of doing those result in back pain and considerable pain. I have a lot of patients ranging from, it doesn't matter whether a gardener or a golfer, that suffer. And even with treatment and exercise, they still suffer back pain after certain activities until they wear a back support. So wearing a back support during the activity that typically stirs your back up, generally, I find, reduces the incidence of back pain. So wearing a back support definitely has its benefits. I also have a number of patients and people that have bought from the website who wear a back support preventatively. So they know that when they do that activity, maybe it's builders, maybe it's whatever, that it always stirs them up. So they wear that back support on the days that their back doesn't feel great, or they're on a day that they know they're going to do something that normally wrecks their back. And to be honest with you, I think if you can reduce your pain as you go about your daily life, prevent injury, prevent what always happens, then a back support has to be a sensible option. Myth number 3 is that bed rest is the best cure for back pain. Okay, I agree as an osteopath. If someone presents to me with acute, and I mean really acute, lower back pain, then some rest is good. But we're not talking about laying in bed for weeks on end. Essentially, anything more than a couple of days bed rest is, I think, and probably most healthcare professionals and your doctor will agree, is actually detrimental to your back. So there's a fine line between movement, there's a fine line between rest, but essentially don't lay in bed hoping that your back will get better. And myth number 4 is that exercise will make my back pain worse. So this is a really common worry for my patients and many people out there, that exercise and you've got back pain is going to be a problem. When you've hurt your back, chances are you're going to see your healthcare professional. So talk to your doctor, talk to your osteopath, chiropractor, physiotherapist. But essentially, from my point of view as an osteopath, I do reduce patients' exercise and the exercise they're doing during times of acute pain. Once you're on the mend, don't be frightened then to start going back to your exercise. And if you're not sure, join a gym, talk to someone down there who's going to teach you safe techniques and techniques that are going to help strengthen your core and your lower back. I'm really a big believer in yoga. I like Pilates. Look at the Alexander technique. All these different disciplines will help you exercise your body, which essentially I think will help prevent episodes of back pain. So I guarantee it will stop all back pain, but it helps strengthen the core and it helps strengthen the musculoskeletal system. So in essence, when you first hurt your back, back off the exercise, get it sorted out, talk to your healthcare professional and introduce exercise gradually. If you've never done exercise, start with something like yoga, Alexander, Pilates, or join the gym, even walking, but get some exercise. It is definitely a benefit for back pain. And myth number 5 is that firmer mattresses are better for my back. Okay, I'm not sure I wholeheartedly agree with that, and I think the more important part when we consider a mattress is I get asked numerous times, I need a new mattress, I need a new bed because my back is stiff in the morning. Right, okay, let's rewind. When you've hurt your back tends to be stiffer in the morning. If you haven't hurt your back and you're getting up with a stiff back, maybe it's your mattress. So if you're having an episode of back pain that's even going on some time, get it sorted out first, then see how your back feels first thing in the morning. If it's fine, you don't need a new mattress. In terms of mattresses, there are lots and lots of sales terms. I've heard Posturepedic, I've heard this, I've heard that. Don't be sold on the name of the mattress. Go along to a specialist centre, talk to someone that knows about mattresses, try the bed out, lay on it, narrow it down in the shop, go back another time and retry them. It's not about the number of springs, it's not about memory foam, it's not about anything except is it comfortable for you and is it supporting you. So I hope you found that information useful. Why not go over to the website and look for more information via my blogs and vlogs. See you soon.